So hello and welcome. Thanks for joining us today. My name is Karin Sitte and I'm the Program Manager responsible for the Foundation's Health Pillar. I'm new to the Foundation. I joined in late 2024 and I'm replacing Lauren, who I'm sure most of you would know. I'm also joined here by my colleague Sarah Hearn, who's our Communications Manager and is going to manage the tech today. So this session is being recorded and will be available on the website in the weeks following the presentation. Before we start, I'd like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional custodians of this land in which I am on today. I would like to pay my respects to their elders past, present, and to any Aboriginal and Torres Strait Islander people listening in today. So hopefully this session today will assist you in understanding the Foundation's medical research program. So in this session, I will provide a program overview. Then I'll talk about the process for application and some of the recent changes. I'll talk about funding objectives and priorities, and I'll give a couple of examples of recent grants that have been funded. And you will have time to ask questions. We'll answer some questions at the end. So if you please put all of your questions in the Q&A. If you have tech issues, put them in the chat, but don't put any questions about the program in the chat, always in the Q&A. And we'll try and answer as many as possible. So about the medical research program, at the Ian Potter Foundation, we have 4 pillars: healthy, fair, sustainable, and vibrant. The healthy pillar has 2 streams: the medical research stream, which is really about funding equipment, and the public health stream, which is currently paused. The program was established in its current form in 2015, and a review was conducted in 2024, and we concluded that there's still a need for this program in its current form. The total funding available is about $2 million, with capacity to fund 12 to 15 proposals every year. So the aims of the program, as stated here, is to advance understanding and improve treatment of major diseases by supporting leading Australian research institutes, universities, and teaching hospitals in innovative biomedical research. And we do this through supporting the provision of medical research equipment and capital infrastructure. So some really important information. This is kind of the critical part about this program. And the first thing is that we will only consider a maximum of 1 proposal per institution. In previous years, it was possible to apply for 2 and provide a ranking, but we've changed that. So this year, we will only consider proposals, 1 proposal per institution. The minimum amount of funding is $100,000 for this program area. And it's unlikely that we will fund the 100% of the project. We expect some co-contributions from either the applicant or from other funders. The duration of the grant is 18 months, and we do that to allow for procurement, installation, commissioning, training, and an initial period of use. There's some exclusions. So if your organisation currently has a medical research grant that is open, so it was awarded either at the end of last year, or you still haven't acquitted a previously awarded grant, then you're ineligible to apply. And also the Foundation will not consider resubmission of previously declined proposals. One of the things to note is that if you have an open grant from another program area or in the public health area, you're still eligible to apply for the medical research grants, but not if you're already holding an open medical research grant. I hope that makes it clear. So the application process, there is no EOI stage. It's a single stage application. So the full application is submitted in one go. As I said before, we will only consider a maximum of 1 proposal per institution, but institutions can be collaborators and other institutions' applications. That's not a problem. If you're a researcher, applications must be processed through your institution's research office or advancement office, or if you're a small research institute, it'll be the trusts and foundation managers or some equivalent. So researchers cannot submit an application on their own. It has to be managed through their institution and through whatever processes they have to select the best application to put forward. So our expectation is that the advancement or research office understands both the institutional needs and the foundation priorities, and will select the single proposal that is strongly aligned with the funding objectives. So how do you apply? Well, the first thing is to go on the website, have a look at the guidelines and the criteria, and see whether there's a match. Then you go and talk to your research or advancement office and discuss with them what process they're going to do internally in order to select the most appropriate application. Once you've had the go-ahead to apply for the grant, then there is templates available on the website which you can then fill in offline, and then you can copy paste into the portal, which is the Giving Data Grantee portal. And as I said before, there's no EOI stage. The funding principle. So at the foundation, all proposals are assessed against the following funding principles: leverage, collaboration, innovation, excellence, sustainability, and potential for impact. In the context of this program, the top three, so leverage, collaboration, and innovation, are critical. And leverage is because we generally don't fund the whole cost of the equipment. These tend to be generally big ticket items, and we expect that there'll be significant leverage either from your host organisation or from collaborators. You don't have to have all funding committed at the time of application. We allow, once the funding is announced, like the grants are announced, if you're successful, you have a grace period to really lock down all of those other commitments if they haven't been fully committed right from the start. The second principle is collaboration. We're looking to fund purchase of equipment that is going to be used by as many research groups as possible, both internal and external, to drive innovation. So often the pieces of equipment that we fund are really filling a gap that doesn't exist in Australia or in a particular geographic location. Sustainability refers to the working life of the equipment, so the longer a working life, the better. And the potential for impact is looking at applications where the equipment can be used to answer many different research questions, driving innovations. And obviously, the more of these principles you can tick off in your application, the more likely is that you are going to be competitive. Priorities. So there's no disease or discipline-specific priority area for the medical research program. So what we're really looking for is successful proposals will have significant co-funding, strong collaboration and support from partners, and that is through the letters of support that you attach to your application. Wide application and use for the proposed equipment, both internal and external, and it addresses a need where there's a gap in research capability. There are some things that we will not support under this program. So equipment and services which should be properly provided for the usual operation of, say, a hospital or health service will not be funded. This could be things like diagnostic or sample processing equipment or anything else that is needed to run that service that should really be provided for by the service. We will not fund recurrent expenditure. So staffing, consumables and maintenance will not be funded under this program. And that also includes institutional overheads. So the program is designed to provide the funding to buy capital equipment. Also, if the equipment should be funded internally or by a government agency, such as an NHMRC project where there's an equipment budget, then we will not fund those pieces of equipment either. So I'm going to run you to a couple of examples of recently funded grants so you get an idea of what we're looking for. So the first one here is the University of New England, who requested to buy a confocal microscope. We funded $150,000, which made up 55% of the total cost of the equipment. So the University of New England is a regional university. It's about 5 or 7 hours drive from Brisbane or Sydney. Their strengths are in health and agricultural research, and their existing microscopy infrastructure was limited to just a fluorescent microscope. 7 research groups needed the equipment for biomedical research in a range of disease applications, including retinal neurodegeneration, rheumatic heart disease, Lesch-Nyhan syndrome, and glaucoma. And also 2 environmental science teams would also use the equipment, and other external groups like the CSIRO and Department of Industry had an interest in getting this equipment. So why did we fund this? Well, there was an obvious capability gap in a regional university with a growing pipeline of Category 1 funded research. There was a wide range of applications and essential to drive innovation in the health research, and there was significant co-funding and in-kind support from the applicant. The second example is the University of Queensland, where we funded the purchase of a Nanine cardio excite and flexite systems. The grant was $100,000, which made up 51% of the total cost of the equipment. There was only one other such instrument available at the time at the Victor Chang Research Institute in Sydney, so clearly people at the University of Queensland wouldn't have been able to easily access that. It was essential capability required to advance development of therapeutics for heart disease, and it was going to be used by multiple research groups across different organisations. So the collaboration was a strong support from existing collaborators, including Griffith University, Prince Charles Hospital, Heart Foundation, Australian Functional Genomics Network, and Infensa Biosciences. So why did we fund this? We funded it because there was, first of all, a strong internationally recognised lead research team, strong support and co-funding from the host institution and collaborators, and wide application to multiple cell types and other organs, so not just for heart disease, but also other diseases. And it was clearly addressing a capability gap to drive innovation. So I think I'm going to stop there and allow you the chance to ask some questions. If you could please put your questions in the Q&A section. So one of the questions here is, what is the maximum amount we can apply for? Well, there is no maximum, but if you think about it this way, we intend to fund about 12 to 15 applications, and we have $2 million. So generally, from what I've seen, and I'm only new here, it's around 50% to 60% of the equipment will be funded by us. And we really require significant co-funding. There's a question about to equip the current medical research grant in June. Can we apply this funding round, which also closes in June? I guess it depends when it was awarded. So if it was awarded 6 months ago, it's unlikely that you'll be able to have gone through the whole procurement and testing and training, et cetera, so we'll have to look at that case-by-case basis. The next question is, does the foundation require letters of support from collaborators who are only using the equipment and not providing co-funding? That's a very good question, and I don't know the answer to that. I think the more support you can get for the need to buy the equipment, then that seems reasonable that you would also get letters of support for people who want to use it. But it's not a requirement. I mean, it's you put your application together the way you see fit to make the best case, I guess is all I can say. The next question is, as digital technology and software becomes more and more important in healthcare, would the IPF consider funding this? That's a great question, and it's not something that I know the answer to, and I can take that one on notice. My understanding is that most of the pieces of equipment come with their software and is part of the installation and part of the package, but I don't know whether there's requirement to buy additional software for the pieces of equipment, so I'll take that one on notice. The next question, is there an expectation for co-funding to be from the institute, or can it be from an industry partner? That's, generally speaking, the host institution will put skin in the game and have some co-funding. Otherwise, why is the host institution making a case to buy this equipment? Can it be for industry partners? You can have co-funding from industry partners, but then the question is this for research or is it for commercialization purposes and commercial purposes? If it's for commercial purposes, that's not really what we're funding. We're funding research. So that's probably a bit line ball, I would say. Next question, are you able to clarify what you mentioned regarding eligibility if we have current funding from NHMRC? So what I refer to with the NHMRC is if you've got a project grant for a specific project that requires a very specific piece of equipment, we wouldn't normally fund that equipment because it should be funded through the project grant, through the equipment component in the budget. So having NHMRC grants does not affect being able to apply for the equipment grant here. I'm not sure if that answers your question. If the co-founder of the large project is government and the smaller pieces under the project is what we are seeking funding for and equipment under paramedicine, will the foundation be considering this as an eligible ask? I don't actually understand that question. If the government should be funding the equipment, the government should be funding the equipment. Like I said before, we're looking for pieces of equipment that are collaborative, that are for research, that are generally big ticket items and are required by multiple research groups. So I'm not sure if that answers your question. Answers what equipment wouldn't be funded. I'm not sure if I would say things like, you know, a pH meter, a PCR machine, those kinds of small pieces of equipment. If you want to buy 10 of those that amount to $100,000, we probably wouldn't be funding that. It's big pieces of equipment used by multiple users and collaborators. So I could rattle off thousands of pieces of equipment. I'm not sure that would be useful. Can we apply for the entire equipment if it's less than $100,000? No, the minimum amount you can ask for is $100,000, and we expect co-funding because we will not fund 100% of the equipment. Are there any other questions? Is there anything I haven't answered that you might still want to clarify? Like some of those questions, I wasn't quite sure I understood the question properly. So please put it in a Q&A. Would any renovation fees for installation be able to be funded? I will take that one on notice. I don't know. Generally speaking, when we fund equipment, I think there have been some instances where people have asked for this. I don't know which way it went, but I can find out. Would you consider funding multiple smaller items where we need to equip across multiple clinical trial sites? Again, it depends how small, and like there are instances where we have funded 2 of something, but I'm not sure whether we'd go 10 for 10 sites. It has to be strongly justified, I would think. Next question, a piece of equipment that can also be used for clinical or diagnostics purposes still be eligible if they have initially been identified for a research need? I don't see why not. I mean, oftentimes that research equipment does have diagnostic, there is crossover into the diagnostics. I'm not sure. And it will really come down to the committee as how they see that, but it should be primarily for research. And it also depends on the piece of equipment. If it's something that's not available anywhere else and is required for research and fills that innovation gap and can also have diagnostic purposes, like for example, one of the big ticket items I can think of is an MRI. Lots of organizations that have MRIs use them both for clinical and research. Next question, if we have few possible types of equipment, we could submit a proposal for it. Is it possible to have a chat with yourself to discuss which piece of equipment might be the best fit? Yeah, look, I'm open to conversations, but I don't want to open the floodgates. And it's really up to the organization to decide which piece of equipment they want to back. There's no right or wrong answer. It really comes down to which piece of equipment does the organization want to back, where do you have the most strong collaboration, and also which piece of equipment has the greatest need. And that's really something that the organization needs to decide for themselves and then put forward one proposal. To clarify my question on co-funding for the larger project, while the government will cover 50% of the funding for the paramedicine project, we still need to raise the remaining 50% through additional fundraising specifically for equipment. Would this be considered an eligible ask in this case? My first question to you is it research? And does it fill a gap in capability that's going to drive innovation? So if you can answer those questions, I'm happy to have a conversation about it. Would you consider funding software requirements for a digital infrastructure platform aimed at coordinating various data sets? I would say probably not. This is for research equipment, so I'm not quite sure that software would fit into that category. Do you know when the public health research grants will be open? We are reviewing our strategy, and they'll be open when they're open on the website, and we will probably let people know when that happens. And equipment for animal facilities be considered? It depends what the piece of equipment is, and as I said before, if it fills a capability gap and will drive innovation, then it may be considered. Depends what it is. There's a question here: is the application form likely to change from last year? I don't believe so. We did make one change to the budget, and that is to make it clear that it's for capital equipment costs only. So we're funding the cost of the equipment and not recurring costs. The next question is $100,000 minimum or maximum? That is the minimum. And also, just to further on that question on the application form, you can actually download the application form on the website to have a look at it to see what fields you need to put in. Question: can you please repeat what you said about proposals that have previously been submitted and were unsuccessful? Can we submit these again the following year or never? The answer is that if they've been rejected by the foundation, then we will not consider them again. Okay, well, I think there's no further questions, and we'll end the session. Thank you so much for tuning in, and yeah, I look forward to seeing your proposals come in. Thank you very much.